Hi friends, Namaskar and a very warm welcome to this video session where we are going to discuss the recently conducted NEET-PG 2024 exam. Before I move forward, a small disclaimer over here that this video session does not intend to directly replicate the MCQs in the exam. Rather, our intention is just to discuss the important topics in the exam and to discuss about the recent pattern of the MCQs in the NEET exam. This time, we all already know that the NEET exam was conducted in 2 sessions. So one point is that in both the sessions, the MCQs were from similar chapters. They were from the similar topics. So as always, it is said in community medicine beta, the show was stolen by two important topics, that is mother-child health and the national health. In mother-child health, we again had 2-3 MCQs from in session 1 and 3-4 MCQs in session 2. We had a question on maternal mortality rate formula, JSSK full form, such a simple MCQ, immediate newborn care steps which are there. And in the session 2, we had neonatal mortality calculation, maternal mortality calculation, anemia Mukt Bharat, child health or the adolescent health. We also had a question from ILR vaccine placement. And then in the in the national health programs, communicable, non-communicable diseases, we had a national leprosy eradication program logo in session 1 and the Sapna image was asked in the session 2. Malaria treatment in session 1, Azar diagnosis in session 2, bedaquiline indication treatment for tuberculosis in session 1 and TB prophylaxis in session 2. And also we had diphtheria contacts management, penicillin vaccine to be given, yes or no, and Samicon vaccine doses from cholera. Then nutrition, there were questions on micronutrients, thiamine in rice in session 1. And in session 2, we had questions from Pellagra for maize and vitamin B3 deficiencies, Zeptamine dropsy, chromatography test, and so on. Then we also had miscellaneous topics like culture barriers were asked in session 1. On the other hand, motivation model was asked in session 2. Disaster stages was asked in both the session 1 and session 2. And then surprisingly in biostats, this time we had 2-3 MCQs in each session. But the important point is that biostats, as always, was relatively very easy format. So they asked a question on sampling methods, median calculation, super easy, and test of significance in session 1, and the test of significance topics was also asked in session 2. Concept in community medicine, like concept of health, disease, and prevention, as always, it's always there. 2-3 MCQs are usually asked. We had questions on isolation, quarantine, generation time. We had HDI calculation in session 1, PQLI calculation in session 2. So demography, family planning, again, 3-4 MCQs are almost always there. So we had questions on demographic stages, both the sessions, IUD insertion and MTP times in session 1, whereas longevity dividend was asked in session 2. Then there was one question on epidemiology in session 1, very super duper easy type, case control study step, environment, Kata thermometer and air quality, air required concept was asked, like how to calculate the air required. So overall, if you just see all the MCQs beta, there were 20-21 MCQs in each session and they were from almost a similar type of chapters. And this time, we had almost 100% strike rate from our Marrow main video lectures in edition 6.5. And we are very proud to say they were also there in rapid revision modules. So overall, it was the complete paper was directly from the lectures, and all the students who had gone through them and studied the videos and notes nicely, they must have attempted it. Talking about the session 1, MCQs in session 1, the first MCQ, a pharmacist selects randomly from 3 groups of medicines of plant, animal, and synthetics randomly. What kind of sampling is it? Simple random, systematic random, and cluster sampling or stratified sampling. Systematic sampling. It's a systematic sampling or cluster sampling. Well, it's a very simple MCQ, direct MCQ, that it is not a simple random sampling. Simple random sampling is where just you take the random numbers. Random numbers will be taken. That is what is a systematic, simple random. Systematic sampling is where every nth person was taken. Stratified is where we divide the population on a certain criteria. If you divide the population based on a certain criteria, and then you take the random numbers of subjects from each strata, that is called as a stratified sample. So this question had been discussed in the main edition 6.5 lectures, video number 21. So we talked about the stratified sampling divided based on certain criteria, direct MCQ, direct answer. Well, the students might get confused that why is it not a cluster sample? See, in this, clusters are naturally occurring groups. They are naturally occurring groups naturally occurring groups, you should not be marking cluster sampling, because what if the MCQ examiner had said that from all the different genre of categories of medicine, may it could be plant, animal, mineral, synthetics, artificial, liquid, solids, whatever genre are they, randomly they took up some clusters, then your answer is cluster. But over here, they had defined 3 sections were taken. In these 3 sections, randomly people were taken. So there's a typical answer of stratified sampling. D option, stratified sampling, is the best answer. And now coming over to the question number 2, which among the following diseases will be best represented in the submerged portion of this iceberg, as you can see? Options given to you were influenza, tetanus, rabies, or chickenpox, right? So this question beta has been extensively discussed in the main lectures, edition 6.5, number 2. And we discussed about the iceberg phenomena, that which diseases show the iceberg phenomena. Which are the diseases which show the iceberg phenomena? You can remember it by the mnemonic PM jumped in the ditch to have ruby. PM jumped in the ditch to have ruby. So what is PM jumped in the ditch to have ruby? P stands for poliomyelitis, M is for mumps. So poliomyelitis, mumps, jump, G, and jump in is influenza, ditch is diphtheria. To have ruby, to stands for typhoid, have is hepatitis A, hepatitis B, ruby is rubella. Please remember it is rubella. These diseases show iceberg. You should also know that which diseases do not show iceberg. Which diseases do not show iceberg? An iceberg is not shown by MTR. M stands for measles, M stands for measles, T stands for tetanus, and R stands for not rubella, it stands for rabies. Please remember, it stands for rabies. These diseases do not show iceberg. So which among the following diseases will be best represented in the submerged portion? So you know that tetanus and rabies is not at all an answer, right? So chickenpox beta, chickenpox, most of the infections which are there, they are not asymptomatic. Initial time, they may be asymptomatic, but eventually they will show chickenpox. Influenza, do you know that influenza, up to 50 to 80%, 50 to 70% of the infections, they usually remain as asymptomatic infections. And that is the reason they show the highest number of the submerged portion. So if you get, sometimes, and this is not black and white all the time. Many times you do get options which are like grayish options. So you have to be clever and you have to be intellectually intelligent enough to understand that which option you're going to mark. So if I give you 2 answers, chickenpox, yes, it shows icebergs. Influenza, yes, it shows iceberg. But which is the answer you're going to mark in the exam? I would like to mark influenza as my best possible answer in this question. Next is, which is the communication barrier if interpretation of the words are understood in a different manner? So interpretation is a problem over here. We are talking about, the topic is communication barrier. Communication barrier. This topic is communication barrier, which has been discussed in detail in edition 6.5, video number 97. So if you talk about the communication barriers, we can have physiological barriers, psychological barriers, environmental barriers, or cultural barriers. If there's too much noise around you, you would not be able to understand what I'm saying. This is called as environmental barrier. If the hearing is impaired, if the person's hearing is impaired, I'm not able to talk properly in English, then there is expression problem. It is called as a physiological problem. You have problem or I have a problem. Psychological is where the level of intelligence is not appropriate or there is emotional disturbance. And cultural is whatever is left out, like different beliefs, different concepts, if you have different understanding, if it is there, or different language. And that is what the MCQ was asked in this year exam, about the language, differential language, which may cause a cultural barrier. So the best answer over here is cultural barrier. It is not psychological, linguistic. It's language, semantic is again not there. So the best answer is cultural barriers. Next, MCQ, identify the image representing the National Leprosy Eradication Program. I think this was the easiest MCQ you would ever get. And this answer over here is NLEP. It is given by this logo number 8. And of course, logo parts, you should know that NLEP has this logo, the lotus flower, and the lotus flower is the leprosy patient. Then the ray of hope, that is the inside, you can see the ray of hope. Ray of hope is the MDT. What is MDT? MDT stands for the multi-drug therapy. MDT stands for the multi-drug therapy. Multi-drug therapy MDT. So it's a very simple direct MCQ. And now coming over to the next MCQ, a student was making a presentation with charts but lost the titles while editing. What possibly could be the heading of the following chart? So what do you think? So you can see over here that there were minimum values and the maximum values. Of course, these values are always different. This is just a presentation of what the MCQ could have been, right? So the options, there were different rows: life expectancy in years, expected years of schooling, mean years of schooling, and gross national income per capita was given. Table number 2, which whatever it was, it shows the 2 years development data. So common sense, I think it's a very simple MCQ. It was telling you about the Human Development Index. It was telling you about the components of the Human Development Index, and it is a super duper 20-star MCQ. Whenever you give exam, you have to know about the health indicators. You have to know about HDI, PQLI, GHI, Global Hunger Index, and the Multidimensional Poverty Index. These are very important indicators. Okay. They have been discussed in main lectures, edition 6.5, number 4. So you can just remember that in HDA, there are 4 indicators we see and 3 dimensions. What are the indicators? Life expectancy in years from birth. So life expectancy at birth. Education includes 2 things. That is the health, that is the expected school years and the mean school years. And then there is also standard of living, which is measured in the GNI per capita. You have the minimum value and the maximum value. The HDI for our country, it is 0.63, and India stands at the rank of 132 among all the countries. So that is just a small point for you to remember. It is actually 0.64 as per the recent data. So that is the best answer over here is Human Development Index. Coming over to the next one, the children in school underwent a health checkup camp whose age was whatever numbers, 2, 3, 4, 5, 6, 7, 8. What is the median age? So whenever you're going to calculate the median is again super duper important MCQ. I tell all the time in my class and in my lectures that usually in your NEET entrance exam, they'll ask you what is mean, median, mode. And that's what it is true. So whenever you're going to calculate the median is always the central value. It is always the central value after arranging in ascending descending order. If the number of value set is odd, you'll get the center value, or you take the center 2 values and you take the center part of that is divided by 2. So in this, you can see 1, 2, 3, 4, 5, 6, 7, and 8. 8 value sets were there. So they were even numbers. So what is the median? You will take 3 on one side and then 3 on one side. So what is the center numbers? You will get 4 and 5 as the center numbers. So 4 plus 5 divided by 2 will be the median. So common sense answer will be 4.5. 4.5 will be the direct answer, median over here, right? Going to the next MCQ, 30 young volunteers with previous lifestyle modifications were contributing on a drug trial for cholesterol levels based on the statin therapy for 9 months. So which of the following tests will be performed? So common sense, you can see that 30 people would with previous lifestyle modifications were contributing for a drug trial, and that drug trial happened to go for 9 months, and then they would see the 30 individuals A level in the start pre-testing, that is what we call as the pre-testing, and then they would also see in the last part like what happened to their cholesterol levels, that is called as the post-testing. Okay. So whenever the MCQ is asked on test of significance, it has been discussed in the main lectures number 19. Talking about the test of significance, you have to see 2 things. First, you have to see what is the type of data. You have to see the type of data, whether the data is a parametric data or a non-parametric data, quantitative data or a qualitative data. Next in line beta, you should also see how many groups are there. If there is a single group, 2 groups, or more than 3 or 3 groups. So number of groups you have to see, and you have to see the type of data. In our question, they talked about the cholesterol levels. Cholesterol levels. They did not talk about dyslipidemias, hyperlipidemia or hypolipidemia or whatever it was. They talked about cholesterol levels, which is a quantitative data. And because it is a quantitative data, it is a parametric test. This is a direct screenshot you can see over here regarding the test of significance from our Marrow edition 6.5 lectures. We talked about the parametric test. So parametric test. Next is number of groups. How many groups did we have? We had only 1 group. one group. So we did before and after testing. So what is the best answer you would like to mark over here? The best answer you should have gone what? A paired t-test. Paired t-test is done in parametric test, single group before and after, pre-testing and post-testing. Next is which of the following information is taken from this formula. So next MCQ, maternal mortality ratio, maternal mortality rate, death rate in reproductive females and total fertility rate. So this question has again been discussed in our main lectures, edition 6.5, lecture number 69. At 18.4, we talked about what is a maternal mortality rate. See, please note that maternal mortality ratio is given by the number of maternal deaths divided by live birth into 1 lakh. We already know this. Now, when the MCQ will ask you not the ratio, they will ask you what is a maternal mortality rate. Now, in the rate beta, the numerator has to be out of the total denominator. The numerator has to be out of the total denominator. So, therefore, the best answer over here is maternal deaths divided by the total number of females in WRA. WRA stands for the women and reproductive group into 1 lakh. So please note that this is the technical formula for correct formula for maternal mortality rate, and this was asked in your exam this year. So lifetime maternal risk could be a prospective MCQ. It is calculated by 1 minus MMR over 1 lakh, and child survival rate, you should also know that it is 1000 minus under 5 mortality rate divided by 10. These are 3 more important prospective MCQs which you may get in future. But anyways, for this MCQ, direct question, direct answer, maternal mortality rate would have been the best possible answer in this question. Okay. So I would also like to tell you that what is the definition of maternal mortalities. How do you define maternal mortality? So maternal mortality is number of female deaths which are due to a pregnancy or related causes within 42 days of delivery. It could also be within 42 days of termination of pregnancy. It could be abortion also, irrespective. Please note it is irrespective of the duration and site of pregnancy. Ectopic pregnancy, whatever it is, everything is calculated, everything is put under the maternal death. So it's an important MCQ and can be asked in your future exams. Coming on to the next one, in a sudden onset disaster, the recovery phase consists of which of the following? Preparedness, response, rehabilitation, or mitigation. Which of the following you think is the best answer? This question again had been directly taken from our lectures beta. So I had made this line. This is going to tell you that this is what area is for the disaster response phase. So disaster response, overall, the disaster response is taken as emergency response or the main response. And then we also include the rehabilitation phase. So of course, this is the longest phase. Rehabilitation phase is the longest phase, and most important phase is the early response, early immediate response, that is within 6 hours. So that is the most important phase. So obviously, which is the best answer? It is the disaster response phase, and the rehabilitation 2 and the 3 only. Option number B is the correct answer. Next is super duper easy MCQ. I don't even want to discuss this MCQ, that what does JSSK stand for? It's a funny MCQ, right? It doesn't discriminate the student based on who has read community medicine and who has not read. Anyway, these type of super duper easy MCQs are always there in your exam. Every pregnant female undergoes free antenatal check on 9th of every month. They wanted to confuse you with the Suman scheme. Free medicines, free delivery, including cesarean section, is done under JSSK. What does JSSK stand for? It stands for the Janani Shishu Suraksha Karyagram. Option number A is the best answer. So what is the use of JSSK? JSSK is everything free, free OPD, IPD treatment, transport. It decreases the out-of-pocket expenses. That is, again, it has been discussed in the lecture number 7070. Coming on to the next MCQ. So this was question from epidemiology, a simple kind of question. It just looks very difficult, but it is in reality very simple MCQ. A study is conducted on the association between, you want to find the association. Remember, in epidemiology, I talked about association, which is given by positive association, negative association, no association, odds ratio, or risk ratio, between intake of vitamin C and the occurrence of respiratory illness, which is the order of the steps which have to be conducted. So you wanted to do a study. So selecting case controls, matching, measurement of exposure, analysis. You already know that in our lectures in epidemiology, I always stress on this very important funda, whenever I try to explain that the most important thing that you have to put into your brain, which can be indirectly asked to you as an interpreted MCQ, is that you always should understand what do you start with. If you start your study with a risk factor, no risk factor, it is called as a cohort study. If you start your study with cases and controls, it is called as case control study. So one thing is very simple, that what is the first step you would like to do in a case control study? You have to start with cases and controls. Okay. Next in line, what will you do next in line? Common sense, you are not going to do analysis. Analysis has to be in the last. Analysis cannot be done after anything else. Analysis is the last thing, right? Just before analysis, you will have to measure the exposure, measurement of exposure. That is what you were supposed to do. So what is left out in this MCQ? You have to take cases and control. If you would have recalled my lectures very nicely, if you would have studied them nicely, you would remember I use the word that you take cases and controls and you match them. You remember I told this, you match them. You match them. So that is where many students got confused, that matching kaha karna tha. Where were we supposed to do matching? Matching, was it done after or before, when? So you take cases, you take controls, you match them, and then you measure the exposure, and then you analyze. And this is what we call as a case control study. This is what we call as a case control study. So what is the option? What is the sequence you're going to look at? So first is option C, then you will do matching. B, then is matching, and then you would like to go forward for measuring the exposure, and last is analysis. So C, B, A, D. C, B, A, D is the best answer you would like to mark in this MCQ. Going forward for the next MCQ, identify the use of this image. It's again a very simple MCQ, beta. What do you see over here? What you see over here is a Kata thermometer. A Kata thermometer. So what are the uses of this Kata thermometer? So it has been discussed in the main lectures, edition 6.5, video number 86. We talked about the uses of Kata thermometer. Uses of Kata thermometer could be low air velocities. The important word was low air velocities. It's not about the air movement. It's about low air velocities and also about the cooling power of air. So what is the best answer over here? Is it air temperature? No. Is it air humidity, radiant heat? No. The best answer over here is cooling power of air. Air temperature is measured by using a simple thermometer. Air humidity is measured by a hygrometer, or we can also use a psychrometer or a hygrometer. And radiant heat is measured by a globe thermometer. Radiant heat is by globe thermometer. So the best answer over here is option number B. Coming to another MCQ, it's a very difficult and very huge looking, tremendously huge looking MCQ. A mother delivers a baby in the rural areas under the guidance of a skilled birth assistant. She gives a clean cut to the umbilical cord, ties the end with new threads, bathes the child with warm water, and wipes the child eyes with a sterile wet cloth from the medial to the lateral corner, from inside to the outside. Finally gives the baby to the mother for skin-to-skin contact. Which of the following steps she performs is incorrect? So which of the steps she has incorrectly performed, you should be knowing. So this question has again been directly taken from our video lectures, lecture number 71 in your main edition 6.5 lectures. We talked about the early newborn care. In the early newborn care, we talked about ABCDE. What is ABCDE? ABCDE, A stands for Apgar scoring, airway checking. Then is B stands for body temperature. You have to maintain the body temperature. And that is where I told you that to maintain the body temperature, you do not have to bathe. Bathing has to be delayed at least till 24 hours, or because there is a very huge risk of hypothermia. So skin has to be maintained. The body temperature has to be maintained, right? C stands for the congenital anomaly. C also stands for the cord care. D stands for the skin care, and E stands for the eye care. In eyes, yes, earlier we were using many chemicals or silver nitrate and so on. Nowadays, nothing special. We just take normal water, normal saline, and we have to wipe the eyes from inside to outside. So which is the only wrong thing which the skilled birth assistant had done was bathing the child because of risk of hypothermia. Coming to the next MCQ, what does line B represent in the graph given below? So it's a very super duper easy MCQ. You already know that this is what we have is the demographic stages. This question again had been discussed in lecture number 61. where you know that there are 5 demographic stages. Stage 1, you have the stage 1, stage 2, 3, 4, and 5. 5 different stages. Stage 1 is high stationary, early expanding, late expanding, low stationary, and declining phase. So you have something called as the birth rate and you have the death rate. So that is what this question was asking, that what is this line number B? So you already know that the line number B over here, it stands for the death rate. This line stands for the birth rate. This is what is a demographic stage or cycle. So I think it's a very super duper easy MCQ. Everybody must have attempted this MCQ nicely. This is option B, which is the correct answer in this MCQ. Now coming over to the next one, a man presents with mixed infections of Plasmodium vivax and Plasmodium falciparum. So this question specifically talked about mixed infection in a health center in Rajasthan. What is the dosage of treatment which is given on the second day? This question was very specific that there was mixed infection for malaria, both Plasmodium vivax and falciparum, and what is the treatment to be given on second day? 4 tablets of artesunate 50 mg and 6 tablets of primaquine, or 4 tablets of artesunate and 6 tablets 7.5, or artesunate 50 mg, 4 tablets sulfur dioxide, 6 tablets of primaquine, 2.5, or primaquine 6.5, whatever it is. So this question was pretty straightforward in asking like mixed infection treatment on second day. But this question we have already discussed. It's again directly asked from our main video lectures. Video lecture number 48, we discussed about the mixed infections. Mixed infections, you already know that the treatment that we are going to give for mixed infections, beta, we are going to give ACT. ACT, we give it as SP or AL, plus we also give primaquine at the rate of 0.25 milligram per kg body weight for 14 days. So that is the treatment we give for mixed infections, right? So now you already know the treatment for ACT, like how do we give the ACT? So ACT is given as artesunate, sulfur dioxide, and pyrimethamine on day 1. Day 2, it is only artesunate, and day 3 is only artesunate. In case primaquine was given, in case it was falciparum, it is given only a single dose on day 2. It is given only a single dose on day 2. And in case it was mixed infection, it has to be given for 14 days. So what is the best answer you would like to mark? The best answer we would like to mark is 4 tablets of artesunate have to be given. Artesunate has to be given plus primaquine has to be given. Now this primaquine is to be given at the rate of 0.25 milligram per kg body weight. Per kg body weight, it is given as 2.5 milligram tablets, and there will be 6 tablets which will be given. In case it was falciparum infection, then in case of Plasmodium falciparum, you would have given on day 2. On day 2, you would have given artesunate plus primaquine, 7.5 milligram tablets, 6 tablets. Are we getting this? So for mixed infections, you would like to mark the single best answer as 6 tablets of primaquine, 2.5 milligrams. These 6 tablets will be continued for total 14 days. Artesunate, you already know, is given only for 3 days. Artesunate for day 1, day 2, and day 3. So what is the best answer over here? You would like to mark option number A as the best answer in this MCQ. Also, if you would like to just know the number of tablets which are given in malaria, you can see this, the table from part 27, page 310. It is the same story that we have discussed in the lectures also, that on mixed infection, that for mixed infections on day 2, what is the treatment we are giving? We are giving tablet artesunate AS tablet plus primaquine. This primaquine is given as 2.5 milligram tablet, and these are given as 6 tablets for primaquine and 4 tablets for artesunate. So this is what you need to give for mixed infection in Plasmodium vivax. Option A is the best answer to be marked. Coming over to the next one, which of the following food product is a good source of thiamine? So probably this was the MCQ, or this could be the MCQ. So I don't know what was the MCQ, but the main funda is question was about thiamine. What is a good source of thiamine? So beta, we have already discussed in our revision lectures, we have discussed in our main lectures number 83, that what are the rich sources of vitamin B1, that is thiamine. The rich sources of vitamin B1, that is thiamine, is organ meat. That is the richest source. Liver, spleen, organ meat of animals is the richest source. But most of the times people won't be consuming this organ meat. What is the next best source? Next best source could be nuts. We can also have the outer covering of grains, that is the outer covering of rice or outer covering of grains and pulses. That is also a very good source of thiamine. That is vitamin B1. So what you can see over here, you can see brown rice. Yes, very good source. Cabbage, green leafy vegetables, lentil. Yes, it could be a good source. Curd is not a good source of thiamine. The best answer over here is brown rice or the full husk rice. That is the best source of thiamine. So green leafy vegetables, in case this was the options, green leafy vegetables not there, curd not there, tomato, pumpkin vegetable is not a good source of thiamine. What is the best answer? Brown rice or parboiled rice. These are good sources of thiamine. These are good sources of thiamine. Coming to the next MCQ, a patient is being examined by the doctor for some occupational disease for which the coproporphyrin test is being done. Identify the disease for this patient is being screened for. Decinosis, berylliosis, plumbism, or Wilson's disease. Well, you already know that in lecture number 96, we discussed about plumbism. What are the investigation of choice for plumbism? The screening test for plumbism, we can do two tests, that is the coproporphyrin test, or we can also do the urinary ENA levels. So both tests can be done as screening tests. What is the diagnostic test? The diagnostic test for plumbism, that is blood lead levels. Blood lead levels is the diagnostic test, whereas the screening test is coproporphyrin and urinary ENA levels. So the best answer over here is plumbism. Best answer would be plumbism. Wilson's disease does not have to do anything with the coproporphyrin. It is just copper deposition. So it is more amount of copper deposition in the tissues. That is not the correct answer. Bicinosis is due to cotton dust and is not related again to the porphyrin metabolism. And berylliosis is due to beryllium. It is due to beryllium, and therefore beryllium pneumoconiosis and berylliosis is also not the correct answer over here. So moving over to the next one, a pregnant female delivers a healthy baby via normal delivery. Earliest time for insertion of IUD is earliest time after normal vaginal delivery. So this question again has been discussed in edition 6.5, video number 66. Direct MCQs have been taken in NEET exam this time. So after delivery, when do we insert IUD? Insertion of IUD can be done within 10 minutes post-placental or within 48 hours postpartum. After 48 hours, we do not do. So either we do post-placental or postpartum. After 48 hours, we do not do. After 48 hours, we insert only after 6 weeks. So what is the best answer over here? It is inserted within 48 hours. That is the best answer I would like to mark for this MCQ. Other options are all wrong answers. Other options are all wrong answers. Coming over to the next MCQ, a female presents with 22 weeks of pregnancy due to rape or sexual assault. Which of the following statement is correct for the medical termination of pregnancy? So which statement is correct? One doctor opinion is required for MTP between 20 to 24 weeks. MTP can be done in 20 to 24 weeks only if the procedure is life-saving to the female. MTP can be done in till 24 weeks in this case. MTP can be done irrespective of the time of gestation. So one thing is very clear, this is not the correct answer. MTP cannot be done irrespective of the time of gestation. But this question also has been discussed much in detail in video number 68 in the edition 6.5 module. So we should know when can we do MTP as per the recent MTP Act Amendment 2021. So I'll just try to simplify the whole game with you. In the recent act, it is said that only one doctor consent or the one doctor approval is required till 20 weeks of gestation. So till 20 weeks of gestation, we can do MTP only with one doctor. From 20 to 24 weeks, two doctor approval is required if the female is in certain categories. What are the certain categories for 20 to 24 weeks of gestation? If the female has undergone any humanitarian problem, sexual assault or rape or incest, or female was minor change in marital status, major disability to the female, fetal malformations, or in other humanitarian settings or disasters or emergency situations. In these cases, the female can undergo MTP from 20 to 24 weeks. After 24 weeks, we need a medical board approval only in case of fetal anomaly. After 24 weeks, the female can get MTP only in case of fetal anomaly. So MTP can be irrespective of time of gestation. In this case, that is wrong answer. One doctor is between 20 to 24 weeks. This is also false answer. This is also false because we need two doctor approval. Just now we learned MTP can be done in 20 to 24 if the procedure is life-saving to the female. No, 20 to 24 only if the procedure is life-saving to female is not kind of, it's like plus or minus answer. Because the 20 to 24 weeks can also be done, MTP can be done to in case of fetal anomalies, in case of change in marital status and other things. So this is also kind of false answer. MTP can be done until up till 24 weeks in this case is the only correct answer. I would like to mark option number C as the best possible. So in this again, the option B and C, there was kind of some confusion among the students, but that's okay. That is how the medical science goes. There are gray zones, but the best answer you would like to mark over here is option number C, and that is the reasonably correct answer. Another MCQ which was asked, I think the last MCQ in the session number 1 was regarding the use of bedaquiline. So for the MDR-TB, you should know what are these alphabets. What is MDR-TB? MDR stands for multi-drug resistant, RR is rifampicin resistant TB. So for MDR and rifampicin resistant TB, what is the indication for short course bedaquiline? Bedaquiline can be given as a short course or a long course. Options given were rifampicin sensitive, only isoniazid resistance, both rifampicin isoniazid resistance with both INHA and CATG gene, only mutation INHA and CATG or CATG with rifampicin, TB meningitis with hydrocephalus. What do you want to answer over? So this question has been nicely discussed and very with a lot of stress. I had discussed during the videos that this question can come in your exam. It has been discussed in edition 6.5 videos. Number 43, where we talked about the indications of short-term oral bedaquiline to be given to the patients. Please note that in cases, I will try to illustrate this point over here again. So in cases where there is rifampicin resistance is detected on the CBNAT. So every case you already know that there is universal CBNAT testing. Once we do the CBNAT testing beta, we will get to know about the rifampicin status. If the rifampicin status is resistant, now we will do the first line LPA, that is to check for the isoniazid resistance. We'll do the liquid culture DST, and we'll check for all the drug resistance to bedaquiline, delaminate, to levofloxacin, moxifloxacin, group A drugs, and so on. Okay. Now listen very carefully. That in case of isoniazid risk, so person is already RR resistant. Plus, in case there is H resistance as well. And with both, the main game changer over here was with both CAT G gene and INHA mutation. With both gene mutation, with dual gene mutation, we are going to give to these people longer bedaquiline, oral bedaquiline containing regime. Are we getting this? On the other hand, look at these on the other side. Look at the other side, this side. So in case there is no additional resistance detected, that is only rifampicin, resistance was there. If there was only rifampicin, or if the H resistance was detected, isoniazid resistance with only CATG or INHA, the game changer is not both. If there is only single gene in H plus rifampicin resistance, we will give the shorter bedaquiline. This direct screenshot from the video lectures. Shorter bedaquiline containing regime has to be given in case of RR resistance, rifampicin resistance, or in case the patient was a multi-drug resistance with isoniazid only single gene resistance. So that is what the MCQ was. A good MCQ, I would say. Slightly kind of on a higher side, difficult side. All said and done, yes, this was kind of a more difficult MCQ. It's not at all a googly or a tricky MCQ. It was a student who has worked at TB or who knows about TB must be attempting this. So it is given to rifampicin sensitive, no. First option wrong. It is isoniazid resistance, no. So this is false answer. Both rifampicin and isoniazid resistance, yes. With both gene, no, this is wrong. It's not both gene. Mutation only to INHA or CATG gene, yes, this is correct. Along with the rifampicin, so it is MDR with single gene disturbance. This is the true answer. This is the true answer. TB meningitis or hydrocephalus is in fact severe TB is a contraindication for shorter bedaquiline containing regime. So that is a contraindication. It is contraindicated. So this is also false option. So what is the single best answer I would like to mark over here is INHA or CATG single gene mutation MDR-TB cases. And now moving on to the session number 2, MCQs in session number 2. First question, which of the following vaccine will be placed at the level number 8? So they had given an image of ILR. ILR stands for the ice line refrigerator. And they had probably written A, B, C, D, and E, right? You have to see that which vaccine is placed at the level number 8, OPV, hepatitis A, pentavalent, or DPT. This question again has been taken from directly from the videos where we discussed about this mnemonic as well. I told you about the vaccine which are to be placed in the lower part of the ILR, that is the coolest area in the ILR. Please remember that the vaccines in the ILR, you can remember it by the mnemonic that don't hit people in this, don't hurt people in this room because Japanese manner outshine. D stands for the diluents. D stands for the diluents. H stands for the hepatitis B vaccine. P stands for the pentavalent. It also stands for the PCV vaccine. I stands for the IPV vaccine, fractional IPV vaccine. This stands for the TD vaccines or the TT vaccines. Rho stands for the rotavirus vaccine. Because stands for the BCG vaccine, Japanese encephalitis. Manners is measles, rubella, outshine is OPV. So this is the sequence of the vaccine which has to be kept in the ILR. The top is always with the diluents and the first vaccine is hepatitis B. The last vaccine to be kept, the lowest vaccine to be kept is OPV. So in the ILR, the placement of the vaccine for OPV has to be kept in the lowest part of the ILR because this is the coolest part because it is the heat sensitive vaccine. Coming to the next MCQ, choose the correct statement regarding the Sanacon cholera vaccine. So cholera vaccines again has been discussed directly. This question is from the lectures video number 31. So cholera vaccines are two vaccines, Dukoral vaccine and the Sanacon vaccine. So whether it is a bivalent vaccine or is it a monovalent vaccine, that was the whole game point. So whether it is a bivalent or a monovalent vaccine, that was the main game point which you had to see in the MCQ. So please remember, on one side, there's again a direct screenshot. You can see this is from the Dukoral vaccine. On the other hand, we have is the Sanacol vaccine. So Sanacol vaccine, please note, is for two vaccines. Sanacol is for two vaccines. Dukoral is only for one type. Dukoral is only for the 01 type. Sanacol is for 01 and 0139. So it has two strains. So it is obviously a bivalent vaccine. So this bivalent vaccine is given in 2 doses, beta. It is given in 2 doses, 2 weeks apart. Whereas the Dukoral vaccine, it is given in 2 doses, 1 to 6 weeks apart, and it contains the beta subunit. Sanacol does not contain the beta subunit. So it is a bivalent vaccine. A or B both have to be true. Given in 2 liquid doses to age more than 1 year. Given in single dose only to age more than 1 year. So which one do you think you would like to mark in your exam? I would like to go with the bivalent vaccine, 2 liquid doses, age more than 1 year. Children, this is what is the treatment. This is what we give for Sanacol vaccine. It is given to age more than 1 year. So A answer is the best answer. Coming to the next MCQ, a hospital collected nasopharyngeal swabs from 1,000 patients every day from the onset of disease. It was found that the count of organism was maximum. Listen to it carefully. It was found that the count of organism was maximum on the 5th day, giving maximum infectivity to 825 patients on that. Okay. So what is this period? 5 days from the onset of disease. So we talk about the maximum infectivity. We talked about the maximum infectivity or the maximum communicability. Maximum communicability. Beta, this is from the lecture number 27. I've taken a screenshot that there is something called as incubation period and then there is the generation time. Incubation period is entry of organism and the first sign and symptom. Generation time is entry of organism and the maximum communicability. So this is what we call as the generation time. Option A is the best possible answer you would like to mark in your exam. Coming to the next one, a homeless man comes with diarrhea, dementia and exfoliative dermatitis. I think you must have understood this MCQ. 4 Ds. You remember? Diarrhea, dermatitis, dementia, and eventually death. He consumes alcohol occasionally. It was there in the option, not there, irrespective. He admits to having subsisting eggs in his staple diet. So he's taking some eggs food in the staple diet. What is this eggs? So obviously we know we are talking about Pellagra beta. There's again a screenshot for video number 77. What are the 4 Ds in niacin deficiency in Pellagra? The 4 Ds in niacin deficiency, you should know: diarrhea, dementia, dermatitis, and death. This is exfoliative dermatitis on the sun-exposed area. Dementia is last to be onset, And diarrhea is the first thing which comes in niacin deficiency. So what are we talking about? Pellagra is always associated with maize eating. So maize is pelagrodenic. Please remember, maize and jowar, they both are pelagrodenic. Maize and jowar, they both are pelagrodenic. Coming to the next MCQ, a 37-year-old female from Bihar presents with complaints of fever, unexplained weight loss over the past 6 months. On examination, she had massive splenomegaly. Her blood investigation shows that she has anemia, thrombocytopenia, low platelets, and hypergammaglobulinemia. So, what is the vector for the organism causing this condition? So, you have to find out the vector. First is you have to identify what the disease we are talking about. So, this female is from Bihar. Bihar should strike you something. Bihar predominant for Kala Azar. When we talk about the vector-borne diseases, in Bihar, I think I must have shown you the graph or the image of India map as well, that Bihar, West Bengal is known areas for Kala Azar. Bihar and West Bengal is known for Kala Azar. When we talk about Kala Azar, leishmaniasis, there are different forms of or types of leishmaniasis. We can have the visceral leishmaniasis, the cutaneous leishmaniasis, mucocutaneous, or the post-Kala Azar, dermal leishmaniasis, PKDA. So, visceral leishmaniasis or the Kala Azar, it is associated with fever, with hepatosplenomegaly, HSM, that is hepatosplenomegaly, with weight loss, with anemia. These are the characteristic classical features of Kala Azar, and you already know that Kala Azar is spread by, what is the vector for Kala Azar, beta? What is the vector for Kala Azar? It is Phlebotomus argentipes. It is not Aedes mosquito, which is for yellow fever, which is for dengue, which is for chikungunya. It is not mite. It is not tick. So going to the next MCQ, in a population of 30,000, there were 500 live births. Okay, that's important, that the live births in the area was 500 and 14 stillbirths, plus 14 stillbirths were there. In year 2023, there were 18 children that died before 1 year. So less than 1 year children deaths is 18. 12 died before 28 days out of this 1 year. Okay, out of this 1 year, within 28 days, there were 12 deaths, and among that, 9 died within the first 7 days. 9 children died within first 7 days. Calculate the early neonatal mortality. You already know that what is early neonatal mortality. So early neonatal mortality rate. Early neonatal mortality rate is death of children, death of children, age less than 7 days. That is what is early neonatal deaths divided by live births into 1,000. That is what we call as early neonatal mortality rate. So obviously, what is the best answer you would like to mark over here? 9/500 into 1,000 is the best answer. So this comes out to be 18 5s are 90 and 18 per 1,000 live births. Per 1,000 live birth is the best possible answer over here. Option A is the correct answer. Going to the next MCQ, a man presents with sudden onset bilateral swelling of legs, diarrhea and dyspnea. So what are we talking about? This is bilateral swelling of legs, diarrhea and dyspnea. Looks like some epidemic dropsy. So has a history of consuming mustard oil. Mustard oil, you remember? Argemone mexicana. Argemone mexicana is sanguinarine. From a local vendor. The health inspector is evaluating the cause of this condition. What is the best investigation? The best investigation you can remember, what we can do is a nitric acid test or a chromatography test. Please remember the best answer over here is that it is the most sensitive test, and usually done test is a chromatography test. However, on public health base, we can also do the nitric acid test. If chromatography is not there in the option, you can always mark the nitric acid, but if both are there, obviously chromatography test is a more sensitive and a better test. Going to the next MCQ, place the first 4 phases of demographic cycle in the correct order. High stationary, low stationary, early expanding, late expanding. Again, this MCQ has been directly from the lecture. So what are the stages of the demographic stages? You already know that the first stage is always high stationary. Next stage is early expanding. Third stage is late expanding, and low stationary is the fourth stage. So that is how the things will happen. So A, C, D, and B. A, C, D, and B is the best possible answer we would like to mark in this MCQ. Next is the image shown corresponds to which program and the disease. A simple image, simple question. This image is from Satna for leprosy. I think most of you must have already done. You should know that there is a Sapna and there is a Meena. Meena is by United Nations. Meena is with parrot and Sapna is Indian going, school going girl child. Coming to the next MCQ, a study is being conducted to determine the relationship between diet and incidence of a disease, any disease. It is found that among 100 vegetarians, among the 100 vegetarian, 30 people have disease. So 30 people out of 100 have disease who are vegetarian, and 100 non-vegetarian, 50 people have disease. 50 out of 100 non-vegetarian people have the disease. What is the biostatistical method to prove that there is no relation between disease and diet? So what is the test of significance? So you already know that the test of significance could be parametric or non-parametric. We have discussed this before also. So when we talk about the disease, and the diet, so this type of data, what is this type of data? The type of data that you are talking is a qualitative data. It is a non-parametric data. It is a non-parametric data. It is a qualitative data. So now you can see that there are two groups. We had two groups. Why two groups? Because there were vegetarians and there were non-vegetarians. So what is the best answer over here? Simple answer, simple question, chi-square test you should be marking in your exam. The best answer over there is a chi-square test. Going to the next MCQ, in the motivation model of health education, there are 3 stages of adoption of the new ideas. What is the third one other than awareness and motivation? So that's an interesting question. So the question already tells us about the motivation model of health education. Under the motivation model, this is, I'm showing you the screenshot from the lecture number 97. So what are the models of health education? You can see that there is a medical model where we tell people about information, we give them content, nobody's ready to listen to the content. Next is a motivation model. Motivation model is you make people aware and then you motivate them, and then this motivation will eventually lead into action. And that is what this MCQ was asking, that what is the third thing that we want people to do? The third thing that we want people to do is to take action. So this action thing was asked in your exam. The best answer over here is action, and you would like to mark option C as the best possible answer. And now moving on to the next MCQ, a disease has an incubation period of 3 to 14 days. So they had already given an incubation period of 3 to 14 days. It has a median incubation period of 10 days. The person had to travel abroad, blah, blah, blah. He was not vaccinated, as a disease of international significance. How long will he have to be quarantined? So this question is pertaining to the word quarantine. Beta, you have to know 2 important things. So this is directly a screenshot from the main lectures number 2. So you have to know 2 things, that is what is isolation and what is quarantine. Isolation is for all the disease people, for all the cases, and it is done for the maximum period of communicability. It is done for the maximum period of communicability. Okay. It is done for the maximum period of communicability. It is a primary level of prevention. Primary level of prevention. On the other hand, if you talk about quarantine, quarantine is done for healthy individuals, and it is done for the maximum incubation period known. It is done for the maximum incubation period known. And this is also a primary level of prevention. So for general purposes, please note, if the incubation period is known to you, you will take quarantine is always done for the maximum incubation period. So you are supposed to mark 14 days as the best possible answer, because quarantine is done for the maximum incubation period. Please remember, isolation is to be done for the maximum communicable period. Moving on to the next MCQ, an unvaccinated 5-year-old child presents with sore throat, difficulty in swallowing. On examination, 5-year-old child, important, age is important. On examination, child has a grayish membrane over her tonsil. This looks like diphtheria to me. She has a fully vaccinated 2-year-old brother who is asymptomatic. What is the appropriate management of this contact? So this question is talking about the diphtheria case contact. So you are talking about diphtheria contact. No intervention needs to be done. Booster dose of toxoid, single dose immunoglobulin, or prophylactic dose of penicillin. So which of the following you think is the best answer? This is a direct screenshot I have taken from the video lecture number 30. So in the main lectures where we talk about flu, diphtheria and pertussis, you know that for management of contacts of diphtheria, For management of contacts of diphtheria, we have to assess their signs and symptoms first. Is in this MCQ, they had given that the child is asymptomatic. Next, you are supposed to take the culture for corynebacterium and diphtheria. And third is we are supposed to give them prophylactic antibiotic. The drug of choice is erythromycin, but we can also give penicillin, single dose penicillin G, or we can give erythromycin. And this has to be given for 7 to 10 days. And antibiotic may be stopped if the culture is negative, but the prophylactic antibiotics have to be given. Next is you should assess about the vaccine. Next is we also assess about the vaccine status. So talking about the vaccine status in close contacts on diphtheria, you already know we will give antibiotics. We've already done this. We will give diphtheria toxoid. This toxoid has to be given to all cases who has less than 3 doses or unknown status. So give complete diphtheria toxoid if the contact had taken 3 complete doses and the last dose was within 5 years, just 5 years ago the person had taken, as in this MCQ, then no extra vaccine has to be given. So in this MCQ, the child does not need any extra vaccine doses. If more than 3 doses and the last dose was taken more than 5 years ago, then you give single dose diphtheria toxoid. You assess for side symptom, you send the samples for diphtheria culture and so on. So what is the best answer you would like to mark over here? We are supposed to give immunoglobulin, wrong answer, false answer. Booster dose is also a false answer. No intervention is also a false answer. What is the best answer? You would like to give them prophylactic dose of penicillin. Coming to the next MCQ, how many parameters given below are components of physical quality of life indicator? Literacy rate, infant mortality rate, per capita, gross national product, 1 only, 2 only, 3 only, all 3, none. What do you want to say? So this question has again been taken from the video lecture. This screenshot has been taken from the video lecture number 4, where we talk about the PQLI. Please remember PQLI, L1, PQL1. L1 means life expectancy at 1 year. So it talks about life expectancy at 1 year. It also talks about knowledge rate, that is the literacy rate. It also talks about infant mortality rate. So it does not talk about income. So it talks about literacy rate, correct. Infant mortality rate, it is correct. It talks about only 2 parameters. It does not talk about the gross national product or the per capita income. Per capita income, you remember, was taken in standard of living, that is HDI. So the best answer over here is 2 only are correct. And now coming on to the next one, which of the following is true about longevity dividend beta? What is longevity dividend? So options given to you were small amount of damage is accumulated, older you are, more prone you are to disease, intervention can delay the onset, economic and health benefit for the society. So what is longevity dividend? It may be a new word, but longevity dividend, we have discussed about a demographic dividend, which is almost similar to longevity dividend. In addition, edition 6.5 main lecture number 61. You already know that what is demographic dividend beta. You already know what is demographic dividend. So you must have seen these 8 pyramids. In this, the bulk, the center part, this is what is the broad belly. This is what is the broad belly. And this broad belly will correspond to the demographic gift. This demographic gift is also called as demographic dividend. We already know this. So what is demographic dividend? Higher number of economically productive population. Why do we have that? Because of high birth rates in the previous demographic stage. Now try to understand, if there are more people in the economically productive population, they'll be having more money. Now because of more money, beta, what happens is the lifespan, longevity means the life expectancy. So this lifespan will increase. That is what is the dividend, what is the benefit of having a longer life? This is what this question was. So if you would have understood my lectures very nicely, you would be able to solve this question. Otherwise, that's okay. You can just read the options and it's a very simple MCQ. I don't know why many students got confused, but that's absolutely fine. So if you talk about this, what is the advantage of a longevity dividend or a lifespan increase? Why would lifespan increase? Because people have the demographic dividend, because they have more money. Because more money, they will live longer. So that is what it means. Small amount of damage is accumulated over time. There's no damage with lifespan. This is false, absolutely false. The older you are, the more prone you become to disease. Yes, this is true. It may be the correct answer, may not, but it looks like to be the true answer. The intervention can delay the onset of disease. Yes, this is also kind of true or false, but it's not possible in all the diseases. You cannot delay the onset of cancer by doing some intervention. So with more lifespan, you're going to get more diseases. It's not going to be delayed. But obviously, It's kind of both plus and minus. Economic and health benefit for the society. That is the best. That is what is the definition of demographic dividend. Because of demographic dividend, you have a longevity dividend, and because of the longevity dividend, there is economic and health benefit to the society. People are going to live longer, and at the age of 50 years, they will start their business. At the age of 70 years, they'll do some new artwork. They will do. They will give some new engineering advice. They have more wisdom now. The country is going to progress more because of a longevity dividend. Why do people get longevity dividend? Because they got the demographic dividend. So they both almost mean the same. Longevity dividend means more lifespan. So what is the advantage? Of course, option B, C, and D all are correct, but D is the correct definition. Longevity dividend or the demographic dividend. Coming to the next MCQ, a population had 4,000 live births. So live births were how many? Live births were 4,000. Among the pregnant females, 6 died antepartum. 6 female died antepartum. Antepartum were 6 during labor or within 42 days of delivery. So antepartum 6 or during labor or postpartum. Post were 6 female. 1 died of sepsis, so all 6 will be included. Okay. So as maternal death, 1 died of sepsis. Sepsis, we had 1. Snake bite, we had 1. Eclampsia, we had 1. Topic, we had 1. And RTA, road traffic accident, we had 1. And obstructed labor, we had 1. So these were the 6 females which died because of antepartum or postpartum or whatever it was. So calculate the maternal mortality ratio. You already know that the maternal mortality ratio, it is given by the formula number of maternal deaths divided by live births into 1 lakh. Number of maternal deaths divided by live births into 1 lakh. You already know that what is a maternal death? Maternal death is any mother death which is due to pregnancy or related causes within 42 days of termination of pregnancy, irrespective of time of gestation or site of pregnancy. Irrespective of the time of pregnancy or site of pregnancy, so it includes everything. So not including accidents and electrocution. Not including accidents, trauma, or electrocution deaths. So that is what is a maternal mortality ratio, or that is what is a maternal death. So which of the following will be accounted for as a maternal death? That was what the MCQ was. So what do you want to answer? Sepsis, will it be included? Yes. Snake bite, no, it will not be included. Eclampsia, yes. Ectopic pregnancy, yes. Road traffic accident, not included. Obstructed labor will be taken as a maternal death. So what is the maternal mortality ratio? It is 4 divided by 4,000. 4 divided by 4,000 into 1,000. 4 by 4 is into 1 lakh, 1 lakh. So 4 by 4 will be 100, I think. Yeah, correct answer is 100. So this question has been, of course, done in our main lectures video number 69. You can have more discussion over there. Going to the next one, which of the following is not included in the school health program under Ayushman Bharat? So they put all the fancy words. However, this question was a very simple question. You did not need to know what is school health program, but of course, common sense. Under school health program under Ayushman Bharat, what are you going to do? So under Ayushman Bharat, we have this Rashtriya Bal Swasthya Karyagram, RBSK, where we do the 4 Ds, diseases, deficiency, defects, and congenital delays for children you check under the school health program. So we do health screening. That is correct. This is obviously a true answer. Deworming for school-going children is massively done under Anemia Mukt Bharat. That is the main important thing. Deworming has to be done for all children aged 1 year to 2 years, giving 200 milligram albendazole. After 2 years, 400 milligram albendazole. Sanitary napkin for adult girls, obviously under for menstrual hygiene and all that. Rashtriya Kishore Swasthya Karyagram, RKSK, and also under the school health program, we are giving them sanitary napkins. Monthly IFA tablets for all children. How on earth would you get confused with this question? So why would you get confused is my simple answer. Why do we give, who told you that we are giving monthly IFA tablets? This was a googly question. This is what is a googly question or a tricky question. We have discussed 7-star I put over here. We have discussed Anemia Mukt Bharat so many times. There is nothing called as monthly IFA tablets. Monthly IFA tablets is not there. It is always weekly IFA tablets. To all adults and children, you remember adults and children will be given blue color tablet 60 milligram, 500 microgram folic acid. It is the same dose that we give to the pregnant female also. So all the adults and children, younger children will be also given weekly IFA tablets. Younger children aged less than 10 years, they'll get 45 and 400 microgram folic acid, 45 milligrams of iron folic acid, iron tablets, 45 milligrams of elemental iron and 400 micrograms of folic acid. Adults and will get 60 milligram iron and 500 micrograms of folic acid, and they both will get the weekly tablets. There's nothing called as monthly. So we give them weekly iron folic acid supplements. It is called as WICS. So that is what is the best correct answer you would like to mark in this MCQ. Moving to the next one, the order of the disaster management cycle. We've already talked about the disaster cycles, that disaster impact, response, mitigation, or rehabilitation. What is the best order? So you already know that in this is a screenshot from video lecture number 95. The first is the emergency response, rehabilitation, then there is mitigation, then there is preparedness and strategy, planning, capacity building, and then there is disaster again. So what is the correct sequence? There is disaster impact, that is first. Then there is disaster response, that is second. Then there is rehabilitation third, and mitigation is the next one. So you would go with A, B, D, and C. A, B, D, and C. A, B, D, and C is the best possible answer I would like to mark in this MCQ. Going to the next MCQ, for standards of ventilation, the widely quoted standard is that of the Thiamine criteria, who advocated a fresh air supply of 3000 cubic feet per person per hour. It is calculated based on which parameter? So in video lecture number 86, we had already discussed that 3000 cubic feet is the air requirement parameter, and they require 2 to 3 air changes because the stale air is there. I did not say the word carbon dioxide, but because of the stale air, you need to have 2 to 3 air changes per hour. So this whole thing, 3000 cubic feet, if you would have heard the lectures nicely, you would have obviously guessed it, but otherwise that's okay. So the air requirement is based on what? Is it based on there are only two correct answers. It's not on humidity, it's not on temperature, right? Either you'll get confused with oxygen or you might get confused with carbon dioxide. The correct answer over here is carbon dioxide content, because the stale air should be changed. So that is what is going to give us the 3000 cubic feet per person per hour of air should be there. It is based on the carbon dioxide content of the air. Next MCQ is again for tuberculosis. Patient is started on 3 HP TPT regime. What is 3 HP TPT? 3 HP, 3 months of isoniazid. H is isoniazid and P stands for rifampicin. Isoniazid and rifampicin. Isoniazid and rifampicin. 3 months of H and P. Please note P stands for rifampicin. Okay. TPT is TB preventive therapy. Which of the following is true regarding? You have to find the true one. Which of the following is true regarding the regime? There is more compliance to 6 months isoniazid and 9 months as compared to 3 HP. Of course not. That is not the correct answer, because 6 months, you give treatment for 6 months and 9 months or 3 months. Where will you have more compliance? This is a simple question, simple answer. So this is the false answer. This is wrong option. No significant difference between 3HP, 6H and 9H. Obviously, that's also wrong answer. There is huge difference. Chance of abortion in 3HP is same as 6H, or 6H is preferred in PNHIV. So let's discuss these 2-3 options below. So this question I've taken from this screenshot I've taken from our main lectures number 44, where we talk about what is the prevention of TB program. So TB preventive therapy, we have this short TPT, that is 3 months of weekly rifampicin. So it is given as weekly tablets, and then there's 3 months of rifampicin. It is recommended as alternate to the 6 months of isoniazid. So it is not equal to 6 months H, it is alternate to 6 month H. What is the best prophylaxis? Best is always 6 months of H. There is nothing called as 9 months of H. That is just a filler option. So talking about what is the TB preventive in PNHIVs or person living with HIV. In person living with HIV, please note that the Prophylaxis of choice, which is given for PLHIVs, person living with HIV, is always 6 months of age. 3HP is always taken as alternate. So for 6 months of age, we will give to all adults and adolescents, we are giving 300 milligrams of isoniazid plus we are giving pyridoxine. I don't say pyridoxine always is attached to the isoniazid because isoniazid is going to cause peripheral neuropathy. So in children, we are giving a same answer, isoniazid, but it is not given standard dose 300, it's 10 milligram per kg plus pyridoxine 25 milligram daily we are giving. So either child or adult, the prophylaxis of choice for preventive TB preventive therapy is 6 months of age. Now, if you look back at the option, chance of abortion in 3HP is same as 6 months of age. This also false. This also false. And then because it is not related to abortion at all. So 6H is preferred in PLHIV. That is obviously the correct answer. It's a direct question, direct answer. 6 months of age is preferred in persons living with HIV. And with that, I'd like to thank you so much for watching this whole module about discussion for NEET-PG Recall 2024 this year exam.